Hello everyone, we are group 3 and we're gonna talk about the case study of Mr. Tong. We have total of 6 group members and I am Chang Kai-yi. Here is our content page. Excluding the 5 questions we need to discuss, we add on few more things that relate to the topics, such as introduction of diabetes and exercise. Before we get on to the discussion, here are some basic information about Mr. Tong. He is a 58 years old Chinese man and he works as a construction worker. His height is 5 feet 11 inches and he is about 240 pounds. About his medical history, he has 3 years of hypertriglyceridemia. After a few discussions, we all agree that Mr. Tong is suspected to have type 2 diabetes. According to the article, Mr. Tong has symptoms including polydipsia, which means his body feels thirst more often. He needs to drink more water to solve the problem. Second of all, he always feeling dry, especially the part of mouth or throat. Last but not least, the polyuria. He has excessive urination. All 3 symptoms is presented in past 2 months. More importantly, they are all consistent with the symptoms of diabetes. Next, we move on to evidence 2. Due to the fact of Mr. Tong's body conditions, he is a high-risk person with type 2 diabetes. First, article given that he has 3 years medical history of hypertriglyceridemia. It is one of the important risk factors for metabolic syndrome-related disease, such as coronary heart disease, hypertension, and diabetes. Secondly, Mr. Tong is 5 foot 11 inches and about 240 pounds. After we translate it to centimeters and kilograms, he is identified as obese according to the standard of body mass index. The third one is Mr. Tong's aging problem. He is now 58 years old. Based on the result of medical research, most patients develop diabetes after 45 years old. Diabetes are separate into 2 types since there are differences between symptoms and illness. For today's topics, we're gonna talk briefly about the type 2 diabetes. It is an impairment in the way the body regulates and uses sugar as a fuel. This long-term condition results in too much sugar regulating in the bloodstream. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. In type 2 diabetes, there are 2 interrelated problems at work. Your pancreas does not produce enough insulin and cells respond poorly to insulin and take in less sugar. Except the signs that present in Mr. Tong's body, there are some other common symptoms of type 2 diabetes. I'm gonna talk it really roughly through some of it. For example, unexplained weight loss, blurred vision, and slow healing of wounds. Numbness of hands and feet, constant hunger, and fungal infection, itchy of skin and genitals are also the symptoms of it. Next, I will pass to my groupmate to talk about patients' laboratory blood test.
Let me me talk about the patient's laboratory blood tests. There are the data of the patient's laboratory blood tests. It shows the changes in the patient's triglyceride level before and after the treatment. The data points that the treatment can help to improve the patient's triglyceride level because we can obviously see the patient's triglyceride level dropped drastically after the treatment. But there is a problem inside the patient's blood test data. The data of fasting stem cholesterol level and high density protein level, which is recorded the HDL or the good cholesterol level, are missed after the treatment, which means it is unable to show the changes in stem cholesterol level and the good cholesterol level after the treatment. We just know that this data before the treatment. It is unable to compare the data changes between before and after the treatment. So therefore, it is not possible to use this data to evaluate whether the treatment brings any effects to the stem cholesterol level and the good cholesterol level.
Mr. Ton's physical examination. His heartbeat is 80 per minute, according the resting heart rate chart for men. In his age, this belongs to below average. And his blood pressure, systolic is 150 and diastolic is 88, and this belongs to between hypertension stage 1 and stage 2. His BMI is 34.4 kg per m square, and this belongs to obesity. What's wrong in the Mr. Ton's physical examination? The first, the height and is using 5-inch 1-1, and the range is so broad in cm. This is not accurate to express the height. The second is the weight, and using 214 pounds, not using kg, and this is hard to transform the pounds into kg and inch into cm, because BMI is calculated by using cm and kg. This is unable to express the BMI meaning. Last one is physical examination did not conducted before the treatment, so how to know the result of difference and change. We know that Mr. Ton still have obesity and high blood pressure based on his physical examination result. The situation of Mr. Ton had not improved.
With type 2 diabetes, if people do not work hard to keep blood glucose level under control, there are short and long-term complications to contend with. In short-term complications, one of the most common complications is hypoglycemia. Hypoglycemia occurs when the blood glucose level goes below 70 milligrams per deciliter. It is possible for people's blood glucose to drop, especially when they take too much insulin or a sulfonylurea drug. Those make your body produce insulin throughout the day. With these medications, if people eat less than usual or are more active, the blood glucose may dip too much. The signs and symptoms of low blood glucose are easy to recognize, such as confusion, increased hunger, nervousness, sweating, weakness, and etc. The opposite of The opposite of hypoglycemia is hyperglycemia. Hyperglycemia happens when the blood glucose goes above normal. It occurs when the body does not produce or use enough insulin, which is a hormone that absorbs glucose into cells for use as energy, and high blood sugar is a leading indicator of diabetes. The symptoms of hypoglycemia include blurred vision or extreme tiredness, frequent urination, increased thirst or hunger, nausea or vomiting, rapid or deep breathing, sweet or fruity smell on the breath. In a long time, high blood glucose can damage the body's blood vessels, both tiny and large. When the damaged blood vessels do not deliver blood as well as they should, that leads to other problems, specifically with the eyes, kidneys, and nerves. Blood glucose level out of range for a long period of time can cause cataracts or retinopathy in the eyes. Both can cause loss of vision. If untreated, kidney disease will lead to impaired kidney function, dialysis, or kidney transplant. Uncontrolled diabetes can cause the kidneys to fail. They will be unable to clean the blood properly. Moreover, the tiny blood vessels feed your nerves, so if the blood vessels are damaged, then the nerves will eventually be damaged as well, such as you will lose all feeling in feet. Type 2 diabetes. Type 2 diabetes can also affect the large blood vessels. High blood glucose and cholesterol levels can cause the blood vessels to narrow and clog. Clogged blood vessels make it difficult for blood to reach all parts of the body. This can result in high blood pressure and increased risk of heart attack or stroke. Also the brain. It can affect our memory, learning, and concentration makes sense because of slowdown in mental functioning.
About the recommended dietary for Mr. Tong, first we should know what food should he eat and avoid. As we can see in this picture, the ratio of things should be 15% of vegetables, 25% of protein, and 25% of starchy food in every meal. So what about the portion? Mr. Tong should eat 2 to 3 servings of fruits every day. Although fruits contain sugar and it will raise his blood sugar level, it's still full of vitamins and minerals. Therefore, it is okay if he eats the right portion and right foods such as apple and berries. And as I mentioned, people with diabetes often try to minimize their intake of white table sugar, as well as treats like candy and cookies. Besides, 2 to 4 servings of starchy food like brown rice and grains can provide energies. Also, protein helps to build muscle and repair damage to the body. Healthy fats like avocado and fish is also good for Mr. Tong, since it supply energy for cells and providing essential fatty acids that your body can make. Then what food should Mr. Tong avoid? As we can see in this picture, eating too much high carbohydrate food and drink is bad for people who have diabetes because it is all processed food with little fiber and also high in sugar, which would affect the blood sugar level. Moreover, eating too much unhealthy foods like cheese and ice cream will cause weight gain since fats are high in calories. Drinking too much alcohol will also interact with diabetes medication. Here is a one-day dietary meal plan for Mr. Tong in controlling his condition and requirements. For breakfast, a sliced whole wheat toast with peanut butter, 1 orange and 1 cup of black coffee are suggested. Whole wheat toast contain carbs and fiber, and peanut butters contain protein and healthy fats. For lunch, I suggest Mr. Tong should eat 2 cups salad with 100-gram chicken breast and a quarter cup of avocado, also with 4 multigreens cracked. If he thinks the salad is tasteless, he could add 2 tablespoons of dressing. There is also a snack for Mr. Tong, which is 160-gram non-fat, no-sugar Greek yogurt with a quarter of mixed berry. Greek yogurts provide protein and calcium, meanwhile, mixed berry provide fiber and both are low calories. As for dinner, I recommend Mr. Tong should have 170-gram baked salmon and vegetable with 2 tablespoons olive oil, also with 1 cup of brown rice and 1 cup of skim milk.
My name is Chan Cam Lam. I'm going to talk about exercise. Exercise is an important part of the treatment of the diabetes. More exercising for energy consumption. Exercise 20 to 30 minutes per day to increase the rate of metabolism. The benefits of exercise are as follows. Helps improve insulin resistance, thereby maintaining or reducing blood sugar levels. Helps reduce blood pressure. Help maintain weight or achieve weight loss. Help reduce triglyceride and increase high-density cholesterol levels. Strengthen muscle and bones. Improve posture and fat positions. Relax body and mix, and increase vitality. In conclusion, at the beginning we have already mentioned about the disease. Mr. Tong is suspected to have type 2 diabetes. The first evidence was consistent with the symptoms of diabetes, and Mr. Tong is a high-risk person with type 2 diabetes because he has 3 years medical history of hypertriglyceridemia, obese, and aging. Based on the history found, we can summarize that Mr. Tong is suspected to have type 2 diabetes. For the type 2 diabetes, the pancreas does not produce enough insulin, and cells respond poorly to insulin. Some typical symptoms such as unexplained weight loss, blurred vision, and consistent hunger. For the complications, in the short term, such as hypoglycemia and hyperglycemia. In the long term, such as eyes, kidney, and nerve disease, and the heart, brain, and blood vessel disease. For the recommended dietary, Mr. Tong can eat more vegetable and some protein and starchy foods. Finally, for the exercise, this is an important part of the diabetes, such as improves insulin resistance and reducing blood sugar levels. This is the end of our presentation. Thank you.